In Canada, the term mental health has certainly surged over the past 5 years. Addressing this issue is not a straightforward process because people have vastly different interpretations of the mental illness spectrum. But if I can make one generalization on the topic, I would say that virtually all Canadians have either personally dealt with or know someone who struggled with mental health issues since 2020. I think this is fairly well documented, but I disagree with the widely accepted belief that stigma is the main obstacle to that type of healthcare in Canada. Indeed, politicians in the Great White North made many empty promises in terms of healthcare as of late. While Canadians were encouraged to bang their pots and pans to recognize healthcare workers, those same workers dealt with chronic underfunding, understaffed hospitals, and much more patients. For example, the Government of Ontario passed Bill 124 in 2019 that would limit wage increases to 1% for registered nurses, nurse practitioners, and other healthcare professionals. Despite the fact that COVID 19 was declared a pandemic in March 2020, the only reason this law was changed over 2.5 years later was that the courts found the law to be unconstitutional. Mind you, this was reportedly the worst global health crisis in the past century, yet attracting and retaining healthcare workers was apparently not a priority. The president of the Ontario Nurses Association said that from 2018 to 2024, for every 10 nurses this government say have been hired, 6 have left. Although it's not my usual type of content, the goal here is to explore some of the common challenges in seeking mental health treatment in Canada. Unfortunately, some of my friends took their own lives over the past few years, and it's not easy to talk about these type of topics. Just as an example, I bet that you didn't know that in 2023, about 1 in 6 Canadians received a prescription for antidepressants. The problem is that those numbers vary significantly. Women are twice as likely to have used antidepressants in Canada, 22% versus 11%, and the province also matters, with Newfoundland and Labrador having the highest prevalence at 1 in 4 people, and 1 in 3 women in that province received a prescription for antidepressants in 2023. I made an editorial choice to use a narrative based format, and I will be talking about uncomfortable topics. Unfortunately, suicide is the second leading cause of death in Canada amongst 15 to 34-year-olds. Women are 3 times more likely to attempt it, but 3 out of 4 people who take their own life are men. Most presentations on mental health don't show these numbers,